Good afternoon. Thank you for joining us. I'm Dave Anderson with the Prosperion Financial Group. We are pleased that you've chosen to carve out some time today to look at Social Security and Medicaid, two big and very important and really somewhat complex topics as we get into our 60s, certainly by age 65. So I'd like to introduce Tim Lenz. He's going to kick it off. He's going to be addressing Social Security. Tim's been in the insurance industry for over 20 years through life experience with his own family, with his own mom, getting into this age frame of 65, health issues with assisted living, those type of issues that really play into Social Security and Medicaid and Medicare. Would love to introduce to you Tim Lenz. Thank you.
Enjoy the session. I'd like to thank Prosperion for having me. My name, again, is Tim Lenz. Who I am, I've been with Colorado Health Insurance since 2004. Connect for Health is the Affordable Care Act in Colorado, and CMS is the company that takes care of Medicare, so I am certified through both those agencies. And like Dave said, I started by having to help my mom with her going into a nursing home, which is always a traumatic experience, and trying to get everything set up so that everything works well with Social Security benefits. So I'll try to talk to you about what is working for us today. We'll start with some highlights. We'll talk about your earning and benefit statements, options for individuals, options for couples, options for widows and widowers, and then determining what age those benefits probably are the best for you to get started. And then, I don't know if questions will be available, but you can ask your advisor about any questions that come up. So first of all, let's talk about what the average benefit is for the first person. Your average benefit this past year has been $13.41 per month, which equals about $16,000 per year. Those benefits are calculated over the last 35 highest years of earning. And any years that you did not have any earning will be a zero, which lowers your average. And this is important because a lot of people know that the next item on there that says they only needed 10 years to qualify, that is to qualify, but they do go back 35 years in taking what your total earnings are to determine your Social Security benefits. And then on top of that, some people will have to pay their federal income taxes on their Social Security benefits, depending on how much money you make in other sources of income that come into you. Okay, so for Social Security Administration, nearly 9 out of 10 individuals age 65 or older receive Social Security benefits. The chart on the right shows how those benefits are used by people on Social Security. So for most people, Social Security makes up 33% of their income. For some people, it makes up 50% of their income, and for others, it makes up 90% of their income. So these numbers here just represent retired workers and their dependents, which account for 72% of the total benefits, and then disabled workers and their dependents, which account for 16% of the benefits. Okay, Social Security is subject to the federal income tax, and what they do to determine your Social Security combined income means they take your adjusted gross income with any non-taxable interest and half of your Social Security benefits, and then they determine in the chart on the right that shows what your taxable income would be on that. So if you're married and below $32,000, you will have no tax, federal tax income. If you are above that, from 32 to 44, it can be up to 50% of your Social Security benefits that could be taxed. And if you're above 44,000, it could be up to 85% of your Social Security benefits that could be taxed. And the note says that it is subject to other substantial income, which includes wages, self-employment, interest, dividends, and other taxable income. The earning and benefit statements that we used to receive used to come every 5 years, but they have been discontinued. Social Security now will only send an earning and benefit statement to individuals who are over 60 and who are not receiving benefits and who have not applied for the My Social Security account online. The link that's on there allows you to create an account with Social Security that you can go in and see your earning and benefit statements exactly the way that the paper document used to be sent out. So I advise all people to go in and make an account and be sure to check your earning and benefit statement every year to make sure it accurately reflects what you did earn, because those will be based on your Social Security benefits. Now, you can only create an account for your own personal information. So your financial agent, advisors, anyone else cannot create that account for you. You must create it yourself, and it is for your own personal use. Some of the things that come up with your earning and benefits statement are there's misconceptions on how it computes an individual's monthly benefits. Okay, your earnings are for each year you work, and it goes back to the 35 highest years. The other thing is, it also brings that earnings up to date when they're calculating your Social Security benefits. So they'll take your past earnings, they run a calculation to bring that up to today's dollars, and then they combine that down to the last thing, which is called bend points, which help Social Security determine whether you, it's really a way of balancing for the individuals who didn't make as much money, bringing their income up, and for those who made a lot of income, it brings their Social Security benefits down. So those bend points are calculated into this, and I'll show you an easier way to compute this than trying to figure this out the way Social Security does. The Social Security Retirement Estimator is not a reliable tool, and that tool only takes the last 35 years. It doesn't really calculate which is the highest. It really doesn't use the bend points, although it does try to bring it up to today's dollars. So it's not really a reliable calculation. You should really get your own numbers and work with your financial advisor to make sure that that calculation is accurate. Okay, so options for individuals. There's basically 3 options for individuals. You can receive your benefits at age 62 or later, up to your full retirement age. The full retirement age currently is based on age 66 if you were born in 1954 or earlier. It's age 66 plus 2 months for every year after 1955. So if you were born in 1955, it would be 66 plus 2 months. If you were born in 1956, it would be 66 and 4 months, so on up to 1960, which puts your retirement age at 67. The last one is you can wait to receive your benefits at age 70. So let's talk about those that are thinking about early retirement. Okay, it's important to remember that it doesn't help you to retire later in life if you have other problems. If your health is not good, if you have family medical histories, or your financial health is not up to well, it doesn't help you to stay poor until you can retire. It's better to take the money early. But for those of us who are healthy, have family history of people who have lived long lives, and are financially stable, it makes sense to try and wait longer to take your retirement. If you do decide to take it prior to your full retirement age, your full benefits are multiplied by a reduction factor. Okay, this reduction factor is 5/9 or 1% for each month the person claimed prior to your full retirement age. But there's a caveat. If you take it greater than 36 months, they're going to lower that even farther to 5/12 of 1%. And there is also a 20% penalty for every month that's greater than 36. So, other things that you might want to consider: you can receive your benefits at 62 and your full retirement age at 66. So your actual reduction is about 25% in monthly benefits. In 2017, the earning excess is $16,920. What this means is that if you decide to retire early, any money you earn over the $16,920 will also reduce how much you receive in benefits. And the amount that is reduced is $2 for every dollar, or it's $1 for every $2 you earn over $16,920. Okay? The other thing to consider is Medicare is not available until age 65, and your current health insurance for most people age 62 to 65 runs anywhere from $800 to $1,000 per month per person. So here's some examples. If we take someone who's earning $1,500, who's calculated that they're going to earn $1,500 in Social Security benefits, if they decide to wait until age 63, which is below 36 months or less, this calculation works really good for calculating a more accurate calculation than the estimated tool that Social Security uses. If they decide that they want to retire right at 62, which will put them at 37 months or more, then the number that they use is 192 minus how many months over 36. The first calculation is based on 36 months. The second calculation is based on months over 36. You multiply those numbers out. You then get that full total amount. Divide that by the number that you're calculating by, which will give you how much you are projected to earn. Now, the reason that the number 37 months or more has a higher number of 240 over 192 is because that has the 20% added penalty in for those months before 36. Okay, the next option is you can always wait until your full retirement age. Okay, Social Security is a good base retirement for your other retirement income. It was never set up to be your retirement program. Okay, in the year that you reach your full retirement age, that number jumps from $16,920 to $44,880. Now, this is only dependent upon when you decide to take your full retirement. If your full retirement, like me, is in October, that $44,880 is how much I can earn to not get a penalty before my month of retirement. If you retire in January and your birth date is in January, then this will not even apply. And how this is done is instead of $1 for every $2 over $16,920, it'll be $1 for every $3 over $44,880. Okay. Here is an example. Did I miss a page? No. Okay, so here is an example of what the lifetime benefit would be. We take some exceptions into play here. If you wait until age 70, your delayed benefits equals about 8% a year. If you take it early, you're going to be at 5/8 of 1% for each month past your full retirement age. So our example here shows a gentleman born in January of 1955. His full retirement benefit is $2,094. His expected death age is $84. If he decides to retire early at 62, his monthly benefit drops down to $1,561. His lifetime benefit being $423,031. If he waits till full retirement at age 66 and 2 months, his monthly benefit is the $2,094, and his lifetime benefit is $464,868. If he decides to wait until age 70, his monthly benefit would increase to $2,736, and his lifetime benefit would also increase to $481,536. Okay, so for couples, they have the 3 normal options that are given to the individual. The thing to remember with couples is it's a free benefit for life, whatever they desire, but the benefit that they choose may affect your spouse, because it's for not only your lifetime, but the lifetime of your spouse. So once you file your application, your options are limited on what you can do to change those decisions. In fact, you have only the first year that you've made that application to make that change. So the big difference really for couples comes in the administration of how your spousal benefits will be affected. So here's some options. You can receive your benefits at 62, either or both of you. Remember that Social Security benefits are individual. So your spouse and you can choose how you want to choose your benefits. You can also receive your full retirement benefits. You can also receive both wait until you're age 70. So the other option that is affected is if you receive your benefits at your full retirement age, your wife or husband can receive spousal benefits. And then there's also an option called voluntary suspension of benefits. So for spousal benefits, what is called deemed filing is if your spouse is alive and receiving benefits, you may be eligible to receive a spousal benefit, even if you do not have enough work credits for your own maximum spousal benefits, and it's 50% of what your spouse receives. In case you both have worked, it's possible to make a claim for your own benefits and claim the greater of your own benefits or your spousal benefits. You can also have you or your spouse might be eligible to receive spousal benefits at age 62. Careful to maximizing the overall benefits for your spouse. So if you take it at age 62, your spouse may not be able to get the full benefits, that the full amount that she would have got if you wait. What happened in 2015 is a law was put in place to close some of the loopholes that were used for someone to file and suspend. That means a spouse would file his benefits and suspend them, allowing him to receive his wife's spousal benefits and his spouse to receive her spousal benefits. This was a restricted application and closed on April 30th, 2016. The spousal action now suspends all benefits, including spousal benefits. So survivors and ex-spouses, they are still available to get benefits, but your spouse is not able to get spousal benefits. So here's an example. We'll go through 4 different examples. Here's what we're going to start with. The husband is born in August of 51, the wife in May of 51. His benefits are $2,090. Her benefits are $1,387 if they wait till their full retirement age. He has an expected death age of 84, which is the average lifespan for men, and she has an expected death age of 86, which is the average life age for women. In option 1, the wife files her own benefits in May and receives $1,387. The husband files and suspends his application in August of 2017 at his full retirement age. The husband files for his own benefit on August 2021 at age 70 and increases his benefit to $2,758. This means that over their lifetime, the husband will receive $463,344. The wife will receive $299,208, and together they'll have a lifetime benefit of $762,552. In option 2, the husband files his own benefits in August and receives the $2,090. His wife files and suspends hers until she reaches age 70, which increases it from $1,045 up to $1,830. The husband receives over his lifetime $431,120. The wife receives $357,600, and their total lifetime benefit is $708,720. In option 3, the wife files her own benefits at age 70, and the husband files his own benefits at age 7. They both increase, and their husband receives a new total income of $463,344 over his lifetime, and the wife receives $373,632 for a total of $836,976. In option 4, The wife is going to file her own benefits and receive her $1,387. The husband files his own benefits at $2,090. So the husband will receive over his lifetime $351,120, and the wife will receive $283,176 for a total lifetime benefit of $824,125. If we go back and see, if they wait till 70, it's $836. If they take it at normal retirement, it's going to be $824. Note in all these options, the wife benefits converts to her husband's benefits at time of death. Options for widowers. Again, options for widowers, they can receive their benefits at age 62. They can wait until full retirement. They can receive their benefits age 70. What they do receive also is survivor benefits at any time after age 60 or age 50 if disabled. Monthly benefits based on the deceased individual's full retirement age. They can choose between survivor benefits or their own benefits. If they remarry before age 60 or 50 if disabled, you will not qualify for a survivor benefit. If you remarry after age 60 or 50 if you are disabled, you may be eligible to receive your survivor benefits, even though you're married to a different person. The basic options for widowers are at age 60, they receive their widower benefits only, and they stay on the widower benefits. They can switch to their own benefits at age 62, if that would be more money. They could switch to their own benefits at full retirement age, so they could continue to take their widower benefits and switch to their own benefits at their full retirement age, or they could continue to take their widower benefits and switch to their own benefits at age 70 and receive the applicable delayed retirement credits. At age 62, they have an option also of switching to their widower benefits at full retirement age. So for a simple pre-retirement checklist, there's really only 3 things you need to look for. First, before you file, make sure you consider all the options available to you and your spouse. Then the second option is to talk to someone recommended is a financial advisor about your decision before actually filing your application to see how that works with your other retirement plans and if that is able to meet your goals in retirement. And then third, if you have filed an application for retirement benefits and you feel you made a mistake, be sure to talk to someone. You have only the first year to make a change, and you will need to do that with an employee of Social Security Administration, or a non-government Social Security consultant can help you explore those options, but the options do need to be made using an employee of Social Security Administration. Any questions we will be happy to answer if you'll send those to your advisor, and we'll be able to then respond directly to your questions. Again, my name is Tim Lenz. These are my contact information. Again, the bottom line is what I recommend to all the people I talk to is that Social Security is a good base retirement for your other income, but it's not your retirement plan. Thank you.
Thank you, Tim. Appreciate your time and expertise. I would like to introduce our next speaker, Dave Suplinski. He's going to speak to us about Medicare and all the different options and how they relate to one another. Dave's been involved with the insurance industry for over 30 years, so he has a deep and broad knowledge that I believe you will all benefit from greatly. So Dave, welcome. Thank you.
Thank you. Again, thank you for having me. And so what we want to accomplish today is a review of Medicare, what it means, and how you go about picking the various options that you'll have when it's your time. So generally, I relate Medicare to kind of the movie, The Wizard of Oz. We all have seen that movie, and we sort of know what happens. When the cyclone hits and Dorothy is trying to get into the house for safety, a cyclone knocks the front door off its hinges and bops Dorothy in the head. Well, that's kind of what happens to us with Medicare. When the time comes, we sort of get hit in the head, and it's here, and we need to make some decisions. So I'm going to kind of build a diagram here on the whiteboard here as to what Medicare is and how it goes about. So I kind of deal in the various world of Medicare, and hopefully you can see this. We're going to call this the world of Medicare. Kind of like Dorothy, when the cyclone takes the house, drops it into Munchkin land. Well, that's kind of what we're seeing with the world of Medicare for a lot of people. We don't want to deal with it until it's upon us, and it's sort of a whole new world. Medicare, unlike Munchkin land, has some rather bland parts to it, creatively called Medicare Part A, B, C, and D. And we know that today Medicare really is the health insurance program that's administered by the federal government. And it's designed for people aged 65 and older, and also for individuals who have certain disabilities or other illnesses. Medicare is basically, as I said, a health insurance program, so you're probably used to an employer-sponsored plan, or maybe you have an individual plan that is really a comprehensive major medical plan. Well, Medicare breaks things down into these four parts called A, B, C, and D. And so when you get to age 65, you know that the federal government says you are now entitled to Medicare Part A and B. Through your working life, you know that you also have been paying into the Medicare system. You see these deductions coming from your check that goes into both Social Security and Medicare, or if you're self-employed, you've been paying taxes to go into Medicare. And because of that, the government says, okay, you get to have a hospitalization plan, which is Medicare Part A. And because you've been paying into it, you pay $0 premium for this hospitalization plan. Well, that's all well and good, but it's not very comprehensive. So essentially, you need to also have Medicare Part B, which is called medical expense. That's doctor visits, outpatient procedures, pretty much everything that doesn't fall under an individual hospitalization stay. Now, Part B, of course, will cost you some money. There is a premium for that. For most people, it's $134 if you're aging into Medicare today. And you have to pay that. You have to have Medicare Part A and B as an anchor to get other options. Some of the other options are, one, Medicare Part C is called Medicare Advantage. And then Medicare Part A and B does not include prescriptions, so you have to have Medicare Part D, which is prescription drug coverage. Part D was created by the Medicare Modernization Act of 2003, and it went into effect in January of 2006, mainly because Medicare itself before that did not cover prescription drug benefits. So Medicare and Social Security are sort of joined at the hip. So you have to enroll in Medicare through Social Security. Now, as you've seen before, if you start drawing Social Security before age 65, then Medicare knows it and you will automatically be enrolled into Medicare by Social Security at age 65. If you're not drawing Social Security benefits when you're first eligible, then you must take action to enroll in Medicare Part A and B. You can do that through the Social Security website at ssa.gov, or you can make an appointment with Social Security, go down to the local office, and they'll get you enrolled. Now, technically, you could get by with just having Medicare Part A and B, although there are a lot of out-of-pocket costs if that's all you have. For example, if you just have Medicare Part A for hospitalization, when you use it, there is a deductible of $1,340 that you have to pay if you were to go in the hospital. Now, what's different about that compared to your employer plan or individual plan is that this is not an annual deductible. It's called a benefit period deductible, and a benefit period is defined as 60 days. So if you go in the hospital, Medicare is going to pay the claim. It'll say that you owe $1,340. Because it's a benefit period deductible of 60 days, it starts from the time that you go in the hospital. Well, then you're released, and if you are not having a very good year and you have to eventually go in the hospital again, beyond the 60 days, Medicare is going to say you have to pay the $1,340 again. So you could pay it multiple times. Part B does have a deductible of $183. That is an annual deductible, but then you have to pay anything over that. You pay 20% of the amount. So Medicare will pay 80%. Now that is an annual deductible, but the issue really is that Medicare does not have a maximum out-of-pocket limit. So combined with any inpatient hospital stay, you could have multiple deductibles of $1,340. You could have that 20% goes on depending on how much you actually have to use the plan. So most people want to enhance the Medicare Part A and B in some fashion. And you can do that in one of two ways. And so there are two decisions that you can make. And the first is you can get what's called a Medicare Supplement. Or you can get what's called Medicare Part C, which is a Medicare Advantage plan. And these are both policies that you buy from a private insurance company to enhance your Medicare benefits in some fashion. Now, they work very differently, and that's the key thing to remember. A lot of people confuse getting a Medicare Advantage plan, and they refer to it as a Medicare supplement, but you really shouldn't do that because they work very differently. So the first scenario, and how do we pick which way we want to go? Well, I say there's like three decisions, three ways that we pick. The first is what's the cost of each plan that we're looking at? What are the benefits of that plan that we're looking at? And then which doctors and hospitals do we get to go to when we buy this particular plan? And this is why the supplement and the Advantage works very differently. So the point of a Medicare supplement is that it works with Medicare. It works with Medicare in paying the out-of-pocket costs that are associated with Medicare, the benefit structure of Medicare Part A and B. In other words, the deductibles and the coinsurance amounts. There are basically 10 standardized plan designs for Medicare supplements labeled A through N. Now, the plan designs of Plan F and Plan G are probably the most popular because they are the most comprehensive in working with Medicare. And so by that, I mean that when you have and buy a Medicare supplement, Medicare is really your insurance company, not the Medicare supplement plan. So that's the key thing to remember, is Medicare is your insurance company. So when you use it, Medicare is going to pay the claim, again, based on the benefit structure of Part A and B. So behind the scenes then, let's say, for example, you went in the hospital, Medicare would say, we're going to pay everything, send you an explanation of benefits, going to pay everything but your deductible of $1,340. That claim is then going to get sent to your Medicare supplement plan. Your Medicare supplement plan is going to pay the $1,340. So as long as Medicare approves the charge, then you really should have no out-of-pocket costs at time of use. Now, the difference between a Plan F and a Plan G is that Plan G does not cover the Medicare Part B deductible. So you would be responsible for paying that Part B deductible. Some of the other Medicare plan designs will have certain out-of-pocket costs that you will accept and have to pay. So most comprehensive plan is Plan F, not Plan G. For new sales, Plan F is actually going to go away in 2020, so depending on when you're eligible for Medicare, you may not be able to get Plan F. You would have to get Plan G. That will be the most comprehensive. So really what we're talking about here is how are we financing our health care as we go into retirement. So again, these are policies you're going to buy from a private insurance company, so it means you're going to pay a premium for this plan, but at time of use, your maximum out-of-pocket is essentially going to be zero, because as long as Medicare approves the charge, it's going to cover paying those deductibles and coinsurance amounts for Medicare. So a big piece to this when you have Medicare is our third element, which is providers. So again, we deal with the world, we'll call this the world of all providers, doctors and hospitals. So with Medicare, we know that not every doctor accepts Medicare assignment. However, there is no network of doctors that's associated with Medicare, so you can go to any doctor or hospital anywhere in the country that accepts Medicare assignment. So you've got a great deal of flexibility when you have Medicare and a Medicare supplement. If you go this route, then you also have to buy a Part D prescription plan, because again, Medicare under A and B do not cover prescriptions, so you need to buy a separate policy. So the monthly premium is going to be, you know, you're going to have your Medicare Part A and B. You must always have that. That never goes away. You have to keep Part B. You'll have a premium for your Medicare supplement, and depending on what plan you want, that's probably going to range in the $130 to $150 range on a monthly basis. You'll buy a standalone prescription plan, that's going to range from about $20 to probably $80 depending on what your prescription needs are. So that's one option, Medicare with a Medicare supplement and a Part D plan. The other option is you can go and get a Medicare Advantage plan. Now it works again very differently than the supplement. With an Advantage plan, that replaces Medicare as your claims payer. So you'll get an actual ID card with the given plan that you buy, as opposed to the first way, you would have Medicare and a supplement plan. Most Medicare Advantage plans are HMOs. There are a couple of carriers that will have PPOs, but essentially you're going to have a smaller network of doctors and hospitals that you will have to go to that are associated with the given Medicare Advantage plan. I kind of call these plans sort of like copay plans because as opposed to the Medicare and Medicare supplement, where you're paying a higher monthly premium at time of use, you have no out-of-pocket. With a Medicare Advantage plan, it's sort of a pay-as-you-go type of plan. You're going to have a copay for each type of service that you use. So if you go to the doctor, there's going to be an office visit copay. If you have lab tests, there's going to be a copay. If you go into the hospital, instead of a global deductible, you're going to have a per night or per day copay admission charge that for a given number of days up to a maximum. Usually the maximum, depending on the plan, is 5 to 7 nights. That would be the most you pay. But that per day might be anywhere from $200 to like $360. So you just have a couple of nights in the hospital, you know, you get by less than the Medicare deductible. If you have 4 or 5, 6 nights, you're probably going to pay a little more. So it's sort of depends on how much you're going to use the plan. Now these plans have a very low monthly premium, but the out-of-pocket goes up because it's pay-as-you-go sort of type of thing. So a Medicare Advantage premium, you can get plans that actually have a $0 monthly premium up to about $100 a month. And the difference is going to be whether it's an HMO or PPO, but most of the HMO plans will go from 0 to about $50. Those plans are usually the same type of plan. The only differences are really you're buying down the copays at time of use. So the office visit copay on a plan you pay a premium for will probably be less than the plan that you have that's a 0 premium. Same with the hospital per day charges. It's usually going to be less on the plan that you pay a premium for versus the plan that you pay no premium for. So again, you sort of pick it based on cost, benefits, providers, and the amount of flexibility that you want to have. So like for example, for the providers on a Medicare Advantage plan, you need to make sure your primary care physician participates with the plan and any specialist that you want to go to. would participate with the given plan. A lot more flexibility with Medicare and the Medicare Supplements. So if you travel a lot, or you're a snowbird, you spend time in several months a year in Arizona, Florida, something like that, you're going to have more flexibility on that with Medicare and the Medicare Supplement. So, the one thing about costs that I want to go back to is Part B. If you are what's considered higher income, and that would be for an individual $85,000 and for a family $170,000, there's what's called an income-related monthly adjustment amount. An acronym is called IRMA, Income-Related Monthly Adjustment Amount. And so what happens is when you apply for Medicare, Social Security looks at your 1040 to see what your income was, but it's a 2-year look back. So if you're applying for Medicare in 2018, Social Security is going to look at what your 2016 adjusted income was. So where it kind of catches you is if you had capital gains, something like that, not necessarily your salary, but they look at what your capital gain was and what your income was. So you could fall under that income-related monthly adjustment. That changes from year to year. So in 2019, they're going to look at your 2017 tax return. So that could be adjusted from year to year. So what are our options when we first become into Medicare? Falls under what we call election periods. So when you're first turning 65, you have what's called an initial election period, and you can enroll into any of the various options with no medical underwriting. So it makes it real easy. You want to get into, make sure that you have a plan that includes Part D. So most Medicare Advantage plans do include Part D versus having to buy a standalone plan. And the reason you want to get into Part D, even if you have very low prescription needs right now, is because if you don't get it when you're first eligible, then there is a penalty that's applied. That penalty is 1% of what the average monthly premium for that year is. So for example, let's say the average monthly premium for a Part D plan is $30. 1% of $30 is 30 cents. That doesn't sound like a lot, but that gets multiplied for each month that you don't have a Part D plan. So for example, if you didn't get a Part D plan for the first year and then you later wanted to get one, you would pay a penalty of 12 months times 30 cents or $3.60. That's a lifetime penalty that gets added on to the premium that you would pay for your Part D. So if you go more than a year, it just keeps building and gets in. So again, you want to get it at your initial election period when you're first eligible. The next enrollment period that you want to look at is what's called the annual election period. And the annual election period says you may change anything in our world of Medicare between the annual election period runs October 15th to December 7th each year for a January 1st effective date. So you may change Medicare Advantage plans or you may change your prescription plan at any time during the annual election period between October 15th and December 7th for that January 1st effective date, because especially with prescription plans, it can change. The formularies can change from year to year. The premiums that change from year to year. So you want to look at what your needs are each year so you can change that. The next election period is what's called a special election period. So if you moved out of the area and moved into a new area, that creates a special enrollment period, and you can then get a new plan whenever you move out of that. Another common one is if you delayed getting into Medicare because you're still working and you work for a large employer and you've had qualifying group coverage, then you would have a special election period that is loss of employer coverage to get when you terminate your employment and lose coverage under that plan. Now notice that Medicare supplements are not in our world of Medicare. So Medicare supplements have their own rules. They don't really fall under the same rules that Part C Medicare Advantage and Part D prescriptions fall. So really, you can't just go back and forth between Medicare Advantage and Medicare supplements once you get outside of your initial election period. You can change plans, but a Medicare supplement carrier can ask medical questions. So because you decide you got a healthcare need coming down, you'd like to get into a Medicare supplement, you might not be able to. So it's easy to go from a supplement to an Advantage plan because you can just disenroll from that period during the annual enrollment period. You have to have a proper election period to get into it, but you could disenroll from the supplement and Part D plan and go to a Medicare Advantage with no medical questions, but you can't go vice versa from a Medicare Advantage to a Medicare supplement without passing and answering medical questions. So you got to be careful. There is what's called a one-time free look. If you start with a Medicare supplement and you want to take a look at a Medicare Advantage, you can enroll in it during the annual enrollment period. You can look at it, try it out. You have a one-time free look that you have to enroll or look at within the first year. So if you decide that it's not working out for you to be in a Medicare Advantage, any time during that first year, you can go back to your Medicare supplement and Part D plan. But you have to do it within the first year that you go into a Medicare Advantage plan. So that's a one-time opportunity to try out a Medicare Advantage plan, go back to your supplement without being penalized. So at this point, if you have any questions, please feel free to talk to your advisor, and
Thank you,
we'll see
Dave.
if we can answer it.
Thank you. Because of compliance, that's the way we have to answer questions. A lot of wonderful information. Hopefully it answered a lot of questions, but I'm sure it created a lot of questions too. So please feel free to contact your advisors with those questions, and we will help get those answers to give you all the tools you need, all the information you need to make the best decision for you. So thank you all for your interest, for your time that you dedicated to attend both the Social Security and the Medicare conversation. We trust it's been very valuable. Thank you again for joining us. Have a great rest of your day. Bye-bye.